Now, 20 million people have insurance through the Affordable Care Act, but repealing it would have an impact on even more people. Dr. Carolyn McClanahan with Life Planning Partners joins us now to talk about how repealing the ACA could impact you. Good to have you here.
Good morning.
Now, I know you've written about this in Forbes magazine. There's the whole political issue, and there are people who say we need to refine and reform and not rescind. Not going to go there. But let's talk about what Congress's actions may mean depending how they proceed with Obamacare. It would have a big impact on the Medicaid program.
It would have big impact on Medicaid, not so much in Florida because we never expanded Medicaid, but 10 million people in the country did get their insurance through Medicaid. They're going to lose that.
How about Medicare?
Medicare, they've made a lot of changes in Medicare. The donut hole that has reduced the seniors' cost of prescription drugs, that was being closed and was going to go away in 2019. It's going to be open wide back up, and seniors are going to pay more for all their prescriptions.
And one of the big concerns is employer-sponsored insurance.
Right. So employers are mandated to provide coverage for their employees. They'll no longer be mandated. And what will happen eventually is that the policies that employees get will not be as broad-based and cover as much as they do now.
How about the individual market?
The individual market, that's where people are really going to be messed over. We've had a lot of people who have moved into creating small businesses because now they don't have to be tied to employer insurance. They could lose all that. About 10 million people get their insurance through the exchange, and more off the exchange. It was guaranteed issue. That may go away.
What frightens you the most about what we're seeing happening on Capitol Hill?
Oh, by far, it's the fact that they are going to bleed this law to death through what's called budget reconciliation, and they want to put money aside for a future health care plan, of which they have no future health care plan. In this country, we need to decide, what do we want to provide for health care for people?
And because they don't really have a viable plan, does that mean more people are going to fall through the cracks than even before Obamacare was established?
That's exactly right. And what's going to happen is, because they have no plan, it's going to throw the insurance market into huge disarray. If the insurers can't plan for what the system's going to look like, how are they going to price their products? We have no idea what's going to happen there.
How does that impact those of us who need to go to the doctor or to the hospital?
Well, you're still going to go to the doctor in the hospital. Doctors, and if you have an emergency, they're required by law to see you in the emergency room and at least stabilize you. So you can still go, but you're going to get a ton of bills. And again, medical problems are the #1 reason for bankruptcy. That's only going to go up.
But you're going to have problems getting an appointment, because I know personally a number of doctors who said, I've had it with the system. I can't practice medicine now. I have to get involved with politics. I have to get involved with so many business considerations. It gets in the way of my being a diagnostician.
Right, and well, and the worst thing is having to cross the T's and dot the I's, and doctors now spend more time with the medical records than they do with their patients because they have to document so much. So there's so much that has just made medicine painful to practice, and we're losing doctors because of that. It wasn't necessarily because of the Affordable Care Act. It was more just because of the bureaucracy we've introduced into the system.
If you had a crystal ball, where does this land in the immediate future?
Oh my goodness, I think we're going to see a lot of pain before we see any resolution. I do hope that people stand up and want and ask for simplicity in the system instead of making it so complicated. Let's make it more simple, which will actually reduce cost. I've written a lot about that.
And that's been one of the biggest problems. People just don't understand this system, let alone how to navigate it.
Yeah, it's too complicated, and we need to fix that.
Thanks for your insights. Appreciate it.
My pleasure.